Hello, students. Today, I'm going to talk to you about a drug called Risedronate, which is used to treat osteoporosis and Paget's disease of bone. I will explain what this drug is, how it works, how it is made, how it is classified, how it is used, and what are its benefits and risks. I will also give you some tips on how to counsel your patients who use this drug and answer their questions and concerns. Risedronate is a type of medication that belongs to a class of drugs called bisphosphonates. Bisphosphonates have two phosphonic acid groups attached to a carbon atom. Risedronate also has a hydroxyl group and a pyridine ring attached to the same carbon atom. The chemical formula of risedronate is C7H11NO7P2, which means it has 7 carbon atoms, 11 hydrogen atoms, 1 nitrogen atom, 7 oxygen atoms, and 2 phosphorus atoms. The molecular weight of risedronate is 305.10 grams per mole. Risedronate works by binding to bone and inhibiting osteoclasts, the cells that break down bone. This reduces bone resorption and increases bone density. This helps to prevent or treat osteoporosis, a condition that causes the bones to become thin and weak. Osteoporosis can lead to fractures, pain, and disability. Risedronate also helps treat Paget's bone disease, a disorder that causes the bones to become soft and deformed. By normalizing bone turnover, risedronate improves bone quality and reduces the risk of complications from Paget's disease. Risedronate is synthesized from 3-pyridyl acetic acid, which is a derivative of pyridine, a heterocyclic aromatic compound with a nitrogen atom in the ring. The synthesis process involves 4 main steps. First, 3-pyridyl acetic acid is converted into an Illinois salt by reacting with phosphorus acid and phosphorus trichloride in methanol. Second, the Illinois salt is hydrolyzed into 3-pyridyl acetic acid hydrazide by reacting with water in a microwave reactor. Third, the hydrazide is cyclized into risedronic acid by reacting with phosphorus trichloride in toluene. Fourth, risedronic acid is neutralized into risedronate sodium hemipentahydrate by reacting with sodium hydroxide in water. The synthesis process does not use any organic solvents other than methanol and toluene, which makes it safe and environmentally friendly. Superscript 1. Risedronate belongs to the 3rd generation of bisphosphonates, which are more potent and selective than the 1st and 2nd generation ones. The 1st generation bisphosphonates include etidronate and toludronate, which have simple side chains and are less effective in inhibiting bone resorption. The 2nd generation bisphosphonates include pamidronate and alendronate, which have amino or nitrogen-containing side chains and are more effective in inhibiting bone resorption. The 3rd generation bisphosphonates include ibandronate and risedronate, which have heterocyclic or pyridine-containing side chains and are more effective in inhibiting bone resorption. Superscript 2. The 4th generation bisphosphonates include zoledronate, which has a nitrogen-containing heterocyclic ring and is the most potent and selective bisphosphonate. Superscript 3. Risedronate comes in 2 forms, immediate-release tablet and delayed-release tablet. Both forms are taken by mouth, but they have different instructions on how to take them. For example, you should not take risedronate if you cannot sit upright or stand for at least 30 minutes after taking the medicine. You should also avoid eating or drinking anything other than plain water before and after taking risedronate. You should follow your doctor's directions carefully when using this medication. Risedronate can cause some side effects, such as heartburn, diarrhea, indigestion, stomach pain, back pain, joint pain, muscle pain, or flu-like symptoms. Some of these side effects may be mild and go away on their own. However, some side effects may be serious and require medical attention. For example, risedronate can cause ulcers or sores in the esophagus, which can lead to difficulty or pain when swallowing, chest pain, or coughing up blood. Risedronate can also cause severe bone, joint, or muscle pain, which may indicate a rare but serious condition called osteoporosis of the jaw or atypical femoral fracture. Risedronate may interact with other medications, supplements, or foods. Therefore, you should tell your doctor about all the products you use, including prescription and over-the-counter drugs, vitamins, minerals, herbal products, and dietary items. You should also avoid taking risedronate with certain medications that can affect its absorption or effectiveness, such as antacids, calcium supplements, iron supplements, or aspirin. You should also avoid drinking alcohol or smoking while using risedronate, as these can worsen your bone health. Risedronate is a prescription drug that requires a doctor's supervision. You should not use it without consulting your doctor first. You should also follow your doctor's advice on how to use it safely and effectively. You should take risedronate exactly as prescribed and do not change your dose or stop taking it without your doctor's approval. You should also have regular checkups and tests to monitor your bone density and blood levels of calcium and other minerals. You should also report any side effects or problems while using risedronate to your doctor. As healthcare providers, you have an important role in educating and counseling your patients who use risedronate. You should explain to them what risedronate is, how it works, how it is made, how it is classified, how it is used, and what are its benefits and risks. You should also answer their questions and concerns honestly and clearly. You should also teach them how to prevent or manage the side effects of risedronate by following proper instructions or using other medications or remedies. You should also encourage them to take other measures to protect their bones, such as eating a balanced diet of calcium and vitamin D, exercising regularly, avoiding falls and injuries, and quitting smoking and drinking alcohol. By doing these things, you can help your patients improve their bone health and prevent fractures with risedronate. You can also help them enjoy a better quality of life with stronger bones. Thank you for listening to my talk on risedronate. I hope you learned something new today. If you have any questions, comments, or feedback, please feel free to contact Bijan AI.
I rock the world with my AI. I'm the best there is, no one's better than me. I'm the king of